Hi, we're back with Alisha and Renee, Chief Operating Officer at Montefiore Medical Center. Welcome back. We're talking about the balanced scorecard where we left off before. So what obstacles did you face during the implementation process?
Well, when we implemented, the obstacles primarily had to do with change, and change is very difficult. With our employees, we did training and we provided them tools so that they would know how they could use a scorecard in their daily operations and how they could use it to improve what it was that we're doing for patients and to make our organization more sound. And along with that, on the higher level, on the director and executive level, we provided incentives. Now, our physician colleagues and some of our stakeholders, we needed to work with a little bit more and clarify with them how, if they got on board with the scorecard, what it could do for them and how it would help them with their practice. And you know, it's a little bit hard. Sometimes there's a feeling that we're trying to direct how patients are taken care of, and that's not really what we were trying to do. What we were trying to do was improve our patient care and improve our organization to make it more solid.
Did you have a lot of resistance from the providers?
Well, we didn't have a lot of resistance. Some of our providers, Dr. Henry was a little bit more resistant, but he became one of my bigger
Advocates?
Advocates,
Like
thank you, advocates, yes, when you talk to him. And he's using a scorecard in the clinic now. So it's been great, and we've become, you know, quite close because of this.
Good. So in your opinion, what do you think is the biggest positive change you've seen from the implementation of the scorecard?
Well, I think the biggest positive change is it's helped us as an organization to have a goal that we focus on, that we all know what it is every day that we need to do to get there. And when we're not doing so well in a certain area, we look at the processes and we look at the measurement so that as a team we can decide how it is we need to go forward and make changes, instead of pointing fingers at people and saying, you know, well, this isn't going right because this provider or this certain department isn't doing what they're supposed to be doing.
I bet that's very effective, taking the blame out of problems that you face.
Yes, it is. It really helps, and it helps everyone to feel better about what they're doing.
Sure.
To have a common goal.
Very nice. Any words of wisdom or lessons learned through this laborious process, I'm sure, of implementing it?
Well, yes. I think, first of all, you really need to identify who your stakeholders are, who your advocates will be, and also who you may have problems with bringing on board. Because some of your bigger stakeholders may be some of the folks that you need to bring on board and get over to your advocate side. And I think you can't provide enough tools for your employees, whether it's on the leadership level or your bedside providers or whatever it is, whoever it is, whatever department it is. And you need to decide as a team what it is that you need to measure and how you're going to do that measurement and where the data is going to come from. Because we know many times the data comes from many locations and you can measure the same thing from certain locations, but it's one location that you need to decide on. And then as a group you need to also understand the scorecard and decide at what point you're going to review it and maybe make changes with adding measures and taking things off.
So changing it up
Yes.
as you go along.
And also how you're going to celebrate. Because, you know, certain milestones you need to celebrate and celebrate in the whole healthcare system, the whole area.
That's a great point. Well, Elaine, thank you so much for joining me. Congratulations on Montefiore's successes, and we wish you many future years of success.
Thank you so much. I appreciate it.
You're welcome.